Welcome to Coordinating Your Child's Health Care, a series that was made possible by Family Voices of Wisconsin and the Wisconsin Medical Home Initiative. We're going to explore what a medical home is and why it's important for your child. A medical home is a way that you and your healthcare provider can work together for regular, ongoing care. It's a way for families to be part of the team to share information, ask questions, and get resources. All children gain from care using a medical home approach. This is especially important for children with special health care needs. In a medical home, your healthcare provider pays attention to the medical and non-medical needs of your child. You partner together to access needed specialty care, other healthcare services, educational services, in and out of home care, and family supports. It also helps with other public and private community services that are important to your child and your whole family. A medical home can be built for every child. It's not a program that parents sign up their children to get. It's a way to give complete and coordinated care that supports your child and your entire family. There are also perks to a medical home outside of the healthcare provider's office. It's often the key to open doors in the community to get the services and supports that your family needs. A medical home is a team, and your child's team can be as big or as small as it needs to be. Families are always part of the medical home team. Some other team members might be doctors, nurses, care coordinators, case managers, family partners, family support groups, community health workers, community groups, school nurses, teachers, social workers, and other educational supports.
My first reaction to the concept of medical home was, it's being what a doctor should be.
A family-centered approach that's compassionate and coordinated and consistent and provides accessibility to the family 24 hours a day, 7 days a week.
Medical home means that I'm welcoming kids into my practice with special health care needs, and actually families who care for kids with special health care needs. And I'm realizing that they may have different needs than people who in general have healthy children.
Medical home is a partnership between your primary doctor and the people that are on your team. Your doctor, your social worker, your nurse, your coordinator, whoever you're using, but your people.
You need me to give you feedback about my kid, and I need to receive your feedback and follow through with the medical care, so it's truly a partnership.
Kids that have multiple medical providers and multiple challenges have charts that are 25 inches thick, that no one in a short period of time can sit down and sift through all of that information. Oftentimes that burden does fall to the parents to try to help the specialist see all of the pieces of the child, and that's very overwhelming.
You shouldn't have to explain yourself every time you go in the door. You shouldn't have to educate somebody about what your condition is or what your personality is or what your preferences are. You should be able to go in and just have that be respected without having to start from scratch building the relationship.
These medical home concepts give you a way to make tangible goals, small goals.
Small steps are okay. One quick change of what you're doing right now is going to make a world of difference down the road.
And working step by step rather than wanting to have the whole product. And it does keep reminding you that it's worth the effort.
All the work and the time and the effort that you spend as a provider caring for these kids, that's just a small price to pay for the great sense of accomplishment and happiness that you feel when these kids do well. Particularly if you see a kid who has huge struggles with their health become an independent adult.
This just defines what I would like to do as a pediatrician. I'd like to be accessible. I'd like to be supportive, family-centered, culturally effective. I now have a pathway to get to the kind of ideal way that I'd like to practice pediatrics.
Choosing your child's healthcare provider is the first step in building a medical home. This may be a pediatrician, family physician, or nurse practitioner. Start by checking with your child's health insurance to find a list of healthcare providers that are in-network. This means that the insurance will cover the cost for this provider. Next, write a list of questions that are important to you about your child's care and bring it to your first appointment. The Family Voices of Wisconsin fact sheet, Finding the Right Doctor, has a list of questions to ask. Once you've found a healthcare provider that's a good fit for your family, that provider will work with you to find other care team members. We're going to stop here to hear about a family that's just beginning to build a medical home for their child. While you're listening, think about who might be included in their child's medical home and the extra services or supports that this family might need. Kenyon was born 6 weeks prematurely. His early arrival took his parents, Selma and Matt, totally by surprise because Selma's pregnancy was normal. Kenyon was moved to the Neonatal Intensive Care Unit, the NICU, for 11 days to give his lungs time to finish developing. When Kenyon was released from the hospital, Selma and Matt were concerned because Kenyon was still having problems with his breathing and he was also having digestive issues. As new parents, they didn't know if they could care for their tiny baby. The NICU nurse reassured Matt and Selma that they could do this and explained that their family pediatrician would be their guide on this journey. This made them wonder if they chose the best pediatrician for their family. They decided to use the pediatrician that Selma's sister uses for her children. She seemed friendly and professional, but Selma and Matt didn't ask her questions about the best way to communicate the extra questions they would likely have, or if her practice would allow extra time to deal with a child who could have special needs. With their first well baby visit quickly coming up, they called the doctor's office and asked to schedule extra time so they could find if she was the right doctor for their family. Families with a medical home tend to be more satisfied with the care their child receives, and the overall quality of care provided to children within a medical home tends to be higher. Let's learn what's involved in coordinated care. Care coordination is the set of activities in the space between doctor's visits, providers, and hospital stays. Care coordination often has most or all of the care team members in a child's medical home. Care coordination is the heart of the medical home. Some of the care coordination activities your child's medical home may assist with include linking your child to needed supports and services, helping you track and understand test results, and smoothing transitions between care settings or providers. Care coordination means that your child's healthcare provider helps connect your family with the right resources and services to make sure that your children stay as healthy as possible between visits. Care coordination works as one team with a lot of tasks. You and your child are part of this team. Not all children need the same amount of care coordination. Those with special health care needs may need more. Maybe you've heard the terms care coordinator, case manager, lay navigator, or care manager. No matter the name, this person is the team member who knows how to access services, seamless care, family support, and advocacy and thinks about your child's strengths, not weaknesses. This team member teaches families about resources and programs in the hospital and in the community. You can find care coordinators working at places like community centers, clinics, and hospitals. You might think of a care coordinator as a superhero. We're going to stop here to hear about a family that's going through some changes with their young child. While you're listening, think about how care coordination could help this family and the role the family might play on the care team.
When Ella was a toddler, Annie and Eric began to worry about her behavior. Ella had always been a happy, easy baby. She would smile and she could entertain herself for hours. As she became a toddler, Annie noticed that some concerning behaviors in Ella that she hadn't noticed before. Ella wouldn't make eye contact. She didn't want hugs, and she would have loud, screaming tantrums if her mom tried to take her away from what she was doing. What Annie and Eric were most worried about is that Ella wasn't babbling and wasn't even trying to talk. Friends would try to comfort Annie and Eric by telling them stories about their own children's terrible twos, but they felt that there was more to Ella's behaviors. They scheduled an appointment with their pediatrician, who recommended that some testing be done as a precaution. The pediatrician's office helped them find the center for the tests and had the center call Annie to make an appointment. After the tests were finished, the doctor at the center explained to Eric and Annie that Ella was on the autism spectrum. The doctor also told them that there are behavioral therapies that can help children like Ella. He said that he would send the results of the tests to Ella's pediatrician along with recommendations for therapies. The parents were scared and confused. They hoped that their pediatrician would answer their questions about autism and behavioral therapies and come up with a plan for Ella.
All children benefit from integrated care in a medical home, but families with children or youth with special health care needs, CYSHCN, may notice the benefits sooner. Children or youth with special health care needs have or are at risk of having a chronic physical, developmental, behavioral, or emotional condition. These children also need health and related services more than other children. The most important task that members of the care team have is communication. As parents, you can encourage this by making sure that the care team knows all of the team members and knowing if they like to communicate by phone, text, email, or in-person appointments. Now we'll learn about how a care map can be a useful tool for your child's care team. Kristen Lynn made her care map to share with her son Gabe's care team. Gabe is a child with complex medical needs. It's amazing to see all of the team members for one child. Kristen started with her son at the center, followed by her family. Then she put other partners involved in Gabe's life on the map. A care map is a blueprint of all the supports that need to be managed by a family for a single child. Seeing this will make your family feel pride in all that you're doing. It also helps you to judge the big picture and talk with your child's care team. Share it with trusted members of your team, including family, caregivers, school staff, therapists, or anyone who needs to see the links to help make care decisions. Now, let's learn how to make a care map for your child. First, start with a blank piece of paper and a pencil. Draw a circle in the middle of the paper and write your child's name. Then draw a ring around your child and label it family. You can also use a picture of your child and family in the center. This is where Kristen Lynn started when making Gabe's care map. Step 2. Outside the center circle for your child and family, draw circles for the people or organizations that are part of your child's team. Place the large groups first and then break them down into smaller groups farther from the center. The most important thing is that it makes sense to you. It may take several tries before it feels complete. Don't worry about getting it 100% right the first try. You may want to use different colors, symbols, and line shapes to show things like barriers, supports, or unmet needs. It's best to keep your process simple. Include your children in the care mapping process if you want. They may even be able to make their own. It will probably look very different from yours, but that may give you some new information. Have one of your kids' care team members help you make a care map. It's an opportunity to get to know this person a little better. By working with someone from the team, you'll both learn a lot. You may need to make appointments to share your child's map, but the team will be interested in the map. Lastly, make copies of your care map and/or scan it. Having an electronic version will let you share it by email. The most important step will be to share this information with your child's team. This helps other team members understand who is on the entire team. Here's the start of a care map for Ella, the child we heard about earlier. This layout is based on the map that Kristen Lynn did for her son. It's very easy to rework to fit your child and family. Now it's your turn. Make a care map for your child. You might want to work with a partner from your child's care team on this. Try to include everyone on the map. If you want to see the care map instructions again, this series is on the Family Voices of Wisconsin and the Wisconsin Medical Home Initiative websites listed on this slide. If you want to learn more, there are resources at the end of this presentation. The next section of the series covers integrated care and creating a shared plan of care. Next, we're going to explore care integration. If coordinated care is a set of activities that happen in the space between visits to your child's health care provider, then integrated care is the focus on care itself. Integrated care is care from the family's point of view on how well members of the care team work together to give high-quality care. Integrated care is the big picture. Coordinated care in a medical home are activities that add to this big picture. Families and caregivers may describe integrated care as holistic care. Integrated or holistic care helps children and their families in 3 ways. First, by giving team-based care. Second, by connecting them to the community and medical care. And third, by planning for the future. When the needs in these 3 areas are met, the child and family have a better experience with health care. Is your child at the center of her care? Are you a partner in an integrated care team? If you have that feeling that parents get when things are a little off, you're probably right. Every kid's care needs are different, with different team members and strengths. What works for another child may not work for yours. Being at the center of your child's integrated care will let you be a better partner in your child's health care. You're the expert, and you have important information to share. Some children, especially those who have complex medical needs, may have more than one care coordinator. In this case, an integrator can help. Who's this integrator? It could be more than one person on your child's care team. It could be you. The integrator is the one who coordinates all of the care coordinators to make a team. The integrator knows your priorities, can coordinate your child's appointments, can think about long-term needs, and can communicate with all the team members. We're going to stop here to hear about a family with a child whose care team is getting larger. While you're listening, think about the 3 parts that make up integrated care: team-based care, connections to community life and medical care, and future care planning. Do you think that this family has integrated care? Is this family treated like members of the care team?
Malik is 4 years old and always seems to have breathing problems. His parents, Randa and Karam, tell his pediatrician that Malik's always stuffy and he seems to have a cold that lasts from fall through spring every year. He's also in the emergency room several times every winter, getting chest x-rays and nebulizer treatments. Malik's pediatrician sees how hard it is for the family to control his asthma and works with them to find a pulmonary specialist, lung doctor, who diagnoses Malik with severe asthma. He prescribes asthma medications and gets the family a nebulizer for at-home treatments. He also wants the family to start giving Malik steroids. He talks about this plan with Malik's pediatrician, who tells him about the struggles that Randa and Karam have had with Malik's behavior, and that he sees a psychologist to learn calming strategies. The pediatrician and the psychologist both think that steroids might increase these behaviors. Instead, Malik's care team and his parents work out a plan to give Malik steroids for the shortest time possible to treat his asthma. Malik's care is coordinated with his doctors and the psychologist, and the family is asked to let the team know if Malik's behavior becomes challenging or if his asthma changes for the better or worse.
Now we'll talk about a shared plan of care, a helpful tool to make integrated care possible for your child.
The care plan is the cornerstone of the whole thing. Without the care plan, it can't work. The care plan is a statement of the child's diagnosis, their medications. It lists the specialists because in an emergency room, knowing who to call for help when you have a child that you don't understand instead of just sending them first and asking questions later is really key.
Rob's been transported a number of times via ambulance to the hospital. He's not able to speak more than yes and no. There needs to be a system in place that will give the medical providers a quick overview and a snapshot of who he is, what his problems are, how he communicates, and what he understands.
It gives the parent and the family a sense of control that this is what I want you to know to be able to take care of my child, so that they can have the confidence that whoever's making medical decisions is making informed medical decisions based on the child's complexity and not just based on what they're seeing at one moment in time.
Good care can be like a baseball game. In our baseball example, the shared plan of care would be the baseball. Care coordination would be throwing the baseball between players, and care integration would be how all the players work together as a team. The word shared is used in the shared plan of care because both parents and care team members share in making and using it. Children who have special healthcare needs, CYSHCN, can have medical records that are very complex. The shared plan of care becomes even more important for them. A shared plan of care makes sure that every team member is working with one set of information and that your child gets the right treatments in the emergency room. It also lets every team member know the long-term goals for your child. There are 3 pieces to a shared plan of care: the medical summary, family strengths and preferences, and the negotiated actions. These 3 pieces need to be complete and easy to use to help make decisions for your child. The medical summary gives your child's current diagnoses, medicines, allergies, and important events like hospitalizations or surgeries. The family strengths and preferences section lists your preferences for your child. The negotiated actions section gives your child personal and clinical goals and the activities to reach these goals. It has timelines and the person responsible for each activity. Hospitals, doctors' offices, and schools keep great records, but you can't count on them being up to date if we're rushing to the emergency room or meeting with a new team member to go over the goals you want for your child. That's why it's good to be ready with information. Having a list of your child's care team members, insurance, and a current list of medicines, including doses and how often the medicine is given, is a great place to start. And remember to have the negotiated actions that you made with your child's care team. The first step in starting a shared plan of care is gathering information about your child. You probably have a lot of this information around your house. Use this list of ideas to start gathering information that you already have. If you want more ideas, the Food and Drug Administration's My Medicine Record is a good resource. It can be found in the Care Notebook on the Family Voices of Wisconsin website at familyvoicesofwisconsin.com or the Wisconsin Medical Home Initiative website at wismhi.org. If you want a little extra time to go through this list, you can pause this slide. Does your child have a special stuffed animal for trips to the doctor? Does your family gather strength from your house of faith? Answers to questions like these belong in the Family Strengths and Preferences section of your child's shared plan of care. Giving the care team information like this can make your child and you feel comfortable in what could be a stressful situation. The negotiated actions part of your child's shared plan of care is about setting goals for your child with the care team. The goals are set together and often include your personal goals for your child along with the care team's clinical goals for him or her. These will probably be a mix of smaller, short-term goals like learning to tie shoes, and bigger, long-term goals or outcomes that you and your child's care team work toward. An outcome is based on your family's values, goals, and expectations for your child. The Family Voices of Wisconsin fact sheet, What Are Outcomes?, explains how to begin planning these goals for your child. One way to start thinking about goals is to ask yourself, what are your fondest dreams for your child? Along with, what do you find most challenging about your child's condition? The answers to these questions can lead to setting goals. To have a good partnership, each team member needs to share information with the other team members. Having a way to keep track of this information over time will lower the chances of extra appointments and tests. It will also help you be a better advocate for services for your child. Taking notes is a good way to understand your child's care, and the best way to start taking notes is before the appointment. On a calendar, write down the appointment date, time, location, and the name of the healthcare provider. Write out any questions that you have. And write out the results you want to get at this appointment and share this information with the healthcare provider. Schools, doctors, social workers, and other professionals will ask you to sign release forms for your child. A release form lets the partners on your child's care team work like a team by sharing information. Releases can help your care feel more integrated. Signing these releases can get your child faster care and can help avoid extra tests and appointments. These team members can't give your child's information to anyone without a signed release form, even in an emergency. It's illegal. This is an important choice for your family, and you should think seriously about signing each one. We're going to stop here to hear about a family whose child has a sudden medical emergency. While you're listening, think about the information to include in a shared plan of care and places where it could be useful. Jessie's an active 7th grader. It seems like she's always on the go for sports, school activities, and spending time with her friends. Her mother, Nora, is happy that she's doing well in school and making friends. This Friday night, she's at a friend's house for a birthday party and sleepover. Nora knows the parents well and has given them information about all of Jessie's allergies, including a peanut allergy, which means that Jessie will need to have her EpiPen with her. Late that night, Nora gets a frantic call from the friend's mother. Jessie has had a seizure, and the parents have called 911 for an ambulance to take her to the hospital. Nora is frantic. She thought she might have to answer a question about Jessie's allergies, but Jessie's never had a seizure before. Nora tells the mother that she's on her way to the emergency room. On the way out of the house, she remembers to grab the notebook with Jessie's shared plan of care. At the emergency room, Nora uses the shared plan of care to tell the staff the names and contact information of Jessie's doctors and gives them a list of her current medicines with their doses. By this time, she's really upset, and having the information written down makes it a lot easier for her. Now it's your turn. Start building a shared plan of care for your child. We've made a care notebook with forms to get you started. But remember, the entire team needs to be included in making a shared plan of care. You can get started, though, organizing contact information for all of your child's team members, medicines, and insurance information. If you want to review the parts of the shared plan of care again, this series is on the Family Voices of Wisconsin and the Wisconsin Medical Home Initiative websites listed on this slide. If you want to learn more, there are resources at the end of this presentation. The next section of this series covers integrated care and families as partners. Now we'll talk about keeping a shared plan of care as a living document. A few strategies will help you with this. Everything's organized, right? You have a shared plan of care for your child with contact information for all of the care team members. You've included all of the medicines and doses, and you have all of the information for the company that you work with for medical supplies. You also worked with the medical home team to make joint goals and activities to meet these goals. Whew! Care coordination needs a strong partnership between the provider and the family. To make sure that the family's needs and preferences are always at the center of this partnership, the shared plan of care needs constant review. In this way, the shared plan of care is a living document that is always open for updates and changes. And, more importantly, these changes make it to the point of care for your child. By everyone on the team working to keep the plan current, it will live on in places like the primary care setting, the school nurse's office, or the exercise center. Things change. For kids, they change so fast that you don't see that you're doing something differently than you were a few months ago. Changes like new medicines or transitioning to a new school are important information to the other members of your child's care team. There's a lot of information in your child's shared plan of care, and the changes needed to maintain it can be time-consuming. Knowing a few simple tricks to keep it current will make this much easier. For starters, know if you're a paper and pen person or a computer user. Whichever method you prefer will be the best way to go. Next, keep all of the information in one place. You might use a tool like the Care Notebook. And if you have your information on a computer, remember that in an emergency you may not be able to connect to the internet or get cell phone coverage, so having a disk or a flash drive as a backup is a good idea. Finally, there are some good template forms available in your Care Notebook to guide you through information that you'll want to keep. Using these forms will make getting organized and staying organized easier for you. Make sure that everyone on your child's team has the most up-to-date information. And remember, what may seem like a small change to you may be very important to other care team members. For instance, it's important to your insurance company that your child's going to start physical therapy at a new office. You need to put every change on the shared plan of care, no matter how small, and give it to everyone on the team. A calendar reminder to check this information periodically will keep this task under control. We're going to stop here to hear about a family with a child who will soon be transitioning to adult life. While you're listening, think about the changes that will be taking place and the role the child should take.
Liam is a teen with special health care needs. Over the years, his parents, Zoe and James, have worked hard to build a strong care team for Liam. They've used tools like a care map and a shared plan of care to make sure that everyone on the care team is on the same page when it comes to Liam's medical information and his goals. But things are changing. Liam will be 18 next year and he'll be transitioning to adult life. While Liam's excited about turning 18, Zoe and James are anxious about all of the changes that will happen. Zoe talks to one of Liam's care coordinators, who recommends that they invite the entire team to meet to discuss these changes at a care coordination meeting. This meeting will include Liam as a team member to discuss everything that will be involved in his transition. This will mean a lot of changes to his shared plan of care, including new negotiated actions of goals, so the group needs Liam's input.
If your child is going to be turning 18 years old soon, there will be some big changes for your entire family. You will need your child's care team to help you with a plan to transition to adulthood. Start by using the tools that you already have, like your child's shared plan of care, for future planning. You may also want to take part in the Family Voices of Wisconsin training, What's After High School, for a broad overview of the transition to adult life for youth with disabilities and/or special health care needs. Also, Build Your Bridge, Moving from Child to Adult Healthcare, introduces healthcare transition and discusses when to start planning for it. Now we'll talk about using your voice to partner with your child's care team and advocate for your child. Building a partnership with your child's care team will help your child get the best kind of health care for every stage in life. There are a lot of ways to start this partnership. You can maintain important information about your child, like a shared plan of care. You can talk with other parents for support, or you can use the resources at the end of this section to find community groups like Family Voices of Wisconsin. These groups have information on different issues that face families in the healthcare system. Then you can share this information with your child's care team. Your insights about your child are valuable information to the care team. Trust your instincts about your child's health. Ask your child's health care provider as many questions as you need, and look for team members who meet your family's needs. You not only have the right to give your opinion, the team wants you to speak up. There might be a time when you know that your child needs something to stay healthy, but the other members of the care team don't know this yet. You're the person who knows your child best, and the decisions made by her care team will have a big effect on your entire family. You have the information in your shared plan of care, and you know about day-to-day life at home. Use your know-how to advocate for your child. It's important for you to advocate for your child. Your goal is to make other people understand your problem and what they can do to help you. There may be different ways to solve problems, but there are some rules to advocacy that are always the same. Be informed, be polite, keep the focus on your goal, ask to talk to the other team members, and follow up afterward. There are so many places where you can use your child's shared plan of care to be an advocate. You can advocate for better emergency room treatment for your child, with your insurance company to cover new therapies, or at the school IEP meeting to get needed support. Remember that knowledge is power, and you have that with a shared plan of care. Just keep your child's plan up to date, and you'll be able to use your knowledge to be an advocate. Advocating for your child with a healthcare provider may seem a little scary, but remember that you are a member of your child's care team and your opinions are valuable because no one knows your child better than you. The Family Voices of Wisconsin fact sheet, "You are an advocate for your child," gives ideas on how to start this process. Wisconsin also has some great advocacy groups that deal with legal and health care issues and will support you in getting answers about your child's care. A list of these groups is included in the care notebook that goes with these sections. Your experience with your child's health care, the good and the bad, can help other families. When you're ready, consider using your advocacy skills to improve health care for all kids. Your voice can have a powerful impact. Think about joining a family advisory committee at your child's clinic or becoming a parent partner at a hospital where your child's receive treatment. Your input will be valued and you'll be helping families like yours. If you want to see this part of the series again, you'll have access to it on the Family Voices of Wisconsin and the Wisconsin Medical Home Initiative websites listed on this slide. If you want to learn more, there are resources on the next slide. If you'd like more information, please visit one of these websites.